5 myths you've probably been taught about virginity. Number 1, the hymen is like a flower or a cherry, and its purpose is to indicate whether or not someone is a virgin. The hymen is just a thin membrane of tissue that partially covers the opening to the vagina, and the whole purpose is to prevent stool from getting into our vaginas when we're babies in diapers. After that, it serves no purpose. The hymen is a body part. It is not a castle wall waiting to be penetrated by the enemy. Myth number 2, a broken hymen means that that person is not a virgin. The myth of the hymen only applies to a very specific definition of sexual contact. The hymen can stretch, it can kind of move out of the way, but it can also break and tear. And not even just through sexual activity. Using a tampon, exercising, injury, medical procedures, all of those can injure or tear the hymen. Number 3, all hymens look the same. Also false. Hymens come in different shapes and sizes just like people. Some hymens are more thin and delicate, some are a little bit more thick. Some hymens are shaped like donuts, others are shaped like crescent moons. Some people are born with no hymen whatsoever. Very rarely, someone can have what's called an imperforate hymen, which means a hymen that's completely closed off. This prevents menstrual blood from getting through, and there's a whole bunch of other different shapes of hymens that you see here. Number 4, if you don't bleed or have pain the first time you have sex, it means that you're not a virgin. Cap, as the young people would say. The hymen is very thin and delicate, and it doesn't get a whole lot of blood supply. So even if you do tear the hymen the first time you have sex, maybe get a drop or two of blood and that's it. Most of the bleeding actually comes from the vaginal tissue, which is very vascular. The first time that you have sex doesn't have to hurt. Just like every other time in your life that you have sex, it's automatically not gonna hurt. That's not how it works. You can experience pain as the hymen is stretched or torn, but a more frequent cause of pain during intercourse for the first time is increased tone of the vaginal muscles, because people tend to be a little bit anxious the first time, but it doesn't have to be that way. Myth number 5, a doctor can tell if you're a virgin. No, we can't. The presence or absence of a hymen doesn't indicate virginity, and virginity testing is unethical. Virginity testing has no clinical or scientific basis. Virginity testing is a violation of human rights. It perpetuates negative sexual stereotypes about women and their purity. It's physically and psychologically abusive. It can be painful, humiliating, or traumatic, and it can be used to discredit survivors of sexual assault.